getting back to normal will not happen overnight. It's going to take time. It won't be as simple or as easy as flipping a switch. It'll require a lot of coordination at the national level, and our government will be there to do that work.
We are nearing the end of week 6 of Canada's emergency response to the COVID-19 pandemic. A lot of focus lately has been on when life can start returning to normal. This week, both Saskatchewan and New Brunswick unveiled their phased-in plan to reopen their provincial economies. For reaction to that, I reached Dr. Alison McGeer, an infectious disease specialist who was a part of the National Advisory Committee on SARS and Public Health. She was in Toronto. Hi, Dr. McGeer. Great to have you with us.
Pleasure to be with you.
Really appreciate you making the time. I want to start off just with a more general question about this concept of reopening the economy. If a province is looking at a number of factors, a number of sort of statistics about how things are going with respect to the spread of COVID-19 in that province, what are the key factors they should be assessing when trying to determine whether it's safe to start reopening the economy?
So it starts with where you are, right? The goal of managing this is to have the least impact on the economy while keeping our healthcare system below capacity or below 100% capacity so that we can still care for patients who have COVID-19. So when you think about starting, you need to know that you have transmission under control. So the number of cases needs to be either stable or decreasing, and it needs to have been happening for a long enough period of time that you're confident that this is baseline for what you're doing now. You also need to know that you understand what transmission is going on. You are able to do testing on people who are ill and contact tracing to the extent that you think is necessary to keep the chains of transmission to a minimum so that when you open up, you're either not going to see new cases or you're going to see a limited number of new cases.
And can you explain in layman's terms what contact tracing is? We hear a lot of politicians talking about it right now.
So when you identify somebody who has COVID-19, then you need to be doing two things. You need to be asking where they got it, and you need to be asking who might have caught it from them in the period of time before you diagnose it, because we know that people can transmit this disease before they become symptomatic. So you find the person and you look at who they might have exposed, and then the person goes into isolation, and the people that they have exposed, the people who might now be incubating disease, go into what's called quarantine, which means it's like isolation, only it's isolation for people who aren't sick. Okay, it's just public health people having fancy jargon for things. Okay, so the exposed people, because of course they might transmit to somebody else before they get sick. So in order to prevent them transmitting from somebody else, you want to identify them before they can transmit it. You want to put them in quarantine so that they cannot transmit it. And that, of course, reduces the amount of spread there is. If you if you have one person and they transmit to two people before they get symptoms, and you don't find those two people, then they go out and infect two more people before they get symptoms, and suddenly you get this very rapid ramp up in the number of cases. So you need to find the contacts and put them in quarantine. You also want to know where the person who you've just diagnosed got their infection. And one of the markers of how well controlled an outbreak is how many new cases turn up that you don't know where they got it from. Okay, when you're at the stage of controlling an outbreak, that's a critical metric of how well you're doing controlling it. Now, we're not trying to control this outbreak to that degree, probably. We're not, I don't think, maybe in Saskatchewan, because they're doing better than some of the rest of us, but I don't think we'll ever get to the stage where we can identify where every case became infected. But you do want to be at some number, at some percentage that tells you that you have enough of an idea of what's going on, that when you allow people to have more contact with each other, and you increase the risk of transmission, that you're not suddenly going to get this exponential increase in cases that's going to make you have to turn everything off again.
So that is what I asked Premier Moe, who we just spoke with on the program a little while ago, because he has this phased approach where in a few weeks the first phase opens and then a few weeks after that is the second phase. And my question had been, well, what happens if in between you see an uptick in the number of cases? And his reply was that he's confident they would be able to, even if they had a marginal increase in the cases, be able to isolate where those cases are, and if it's confined to a home, they would be able to do that contact tracing. What are your thoughts on that?
Well, that's what we're all hoping, and it's just, and the reason that these approaches are staged is because this is a new virus. We haven't done this before. It's really hard to be absolutely sure about what's going to happen. So you take a staged approach. You try to open things that are important to people, important to the economy, have the least risk of exacerbating transmission, and then you try it out. And if cases may go up a bit, and that might be tolerable. Whether it's tolerable or not depends on how it moves you relative to the capacity in the health system, and what direction they're going in, right? Because we've all seen in a number of different countries how quickly transmission can be amplified and how much trouble you can get into fairly quickly. So people will be watching it very carefully, and I think we're all hoping that we can take this staged approach, we can figure out where the balancing act is, and we can keep going. But I think it's likely that in some areas we will end up having to go back because we've gone too far and transmission starts to accelerate again. And the good news is, of course, we know what we have to do now, right? We've got a system. It's draconian. It's very hard on a lot of people, but it does stop transmission. Substantially stop transmission. So that's very good news. We know what we have to do. Now the question is, what's the minimum we have to do? And we'll just have to keep working towards that.
Before I let you go, Doctor, I think a number of people are watching right now, and I imagine especially in the provinces that are like Saskatchewan, starting to think about reopening their economy and wondering, once some of those restrictions are loosened and we don't all have this sort of edict as to how to act, what kind of precautions they should still be taking themselves. Do they need to, for example, maintain that 1 meter distance everywhere? Should they be wearing a mask? I'm just wondering, for those people right now who are watching, what your message is when they are in a province or in an economy that is starting to open up again.
Again, I think what we can best do, each of us, is have the minimum contact with other people, the minimum physical contact with other people that we can get by on. So, those of us who have jobs and are busy, okay, I may not like living without contact with my family or without contact with my friends, but I can do that. It's not that bad, and I understand completely how fortunate I am. So then my responsibility to make sure that I'm not having contact that's not essential to me, because what each one of us does matters across the whole country. So there are people who need jobs, who have to be able to pay the rent, who need to feed their children. Those are the people we want to get working again. Those are the people that we want to be able to be out and have more contact. And so I think each one of us Canadians needs to be saying, what's the minimum contact I can live with? And then each of us also needs to be listening to our public health authorities about just what we should be doing, because they're the people who are trying to ease restrictions as quickly as they can. And it does involve all of us working together on this.
Okay, I'll leave it there. Thanks so much for your insights this evening, Dr. McGeer. Real pleasure to have you with us.
Pleasure to talk to you. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.